And while talking about the payer of last resorts, I want to show you some of the research that I did to help tell this story to people who are considering a long-term care insurance plan for their family. We're looking at some live websites right here. This is the Federal Ministry of Health for the country of Germany. You might be surprised to learn that Germany's required their citizens to have long-term care insurance since 1995. And in fact, in 2015, they passed a law to strengthen their long-term care insurance plan. You can read along with me here. The new long-term care need definition and the associated improvements, benefits, and services. Long-term care insurance contribution will increase to 2.55% of your income or 2.8% for people who don't have children. I'm not going to go through all of these in that great detail, but I do want to show you, and we'll try to hot link these websites maybe in the corner of the screen so you can look at them as you have time. In Austria, it's been since 1993. They've had a federal act for long-term care. Japan, since 2000, I believe, has had a long-term care insurance program. If you're over the age of 40, you're required to have long-term care insurance. In Korea, public long-term care insurance for citizens since 2008. The Netherlands, and this is an interesting program as we look at it, the Long-Term Care Act is a statutory social insurance for those who pay an income-dependent premium through their payroll tax. The amount of premium is based on a fixed percentage of 9.65% of the income tax on a maximum of 33,000 euro. So it's something they believe is really important, and that's what they require of their citizens. France has, of course, laissez-faire economics. They believe in a free market system in most cases, and they have about 3 times the number of folks who've purchased long-term care as a percentage of their population than the United States. They've done a great job educating their population on the importance of it. You may be familiar with the national health care system in Great Britain, the NHS, which pays for it is socialized medicine. It will pay for your recovery care. What it does not pay for is your long-term care. If you have more than £25,000 in assets, you're called a self-funder. So they're looking for ways to encourage their citizens to plan for their extended health care needs. Here's a paper that was written by Adelina Comos-Ferreira from the London School of Economics and Political Science, talking about the different ways maybe they could encourage their citizens to plan for their extended healthcare need. And while we're talking about that, Genworth is a great company. Genworth Financial has been in the long-term care insurance industry for 40 years. The problem is, 40 years ago, they didn't know how to underwrite or price this coverage, so they've been really hemorrhaging money and paying claims for their long-term care. And in September of last year, their shareholders voted to sell Genworth Financial to China Oceanwide Holdings, a Chinese investor. Now, when asked why would China Oceanwide Holdings purchase Genworth, McInerney says very clearly, we have 47 million Americans over the age of 65. They have 225 million in their population in that category. And with their one-child law, their demographics are upside down. So they're interested in purchasing Genworth to go back and create a long-term care insurance business in China.